Hi everyone, Saied is here. I'm the founder of iCareBetter. I want to walk you through how the review process for video vetting looks like and show you some results, some examples that have passed and some that haven't passed. So this specific application is public on iCareBetter.com, for example, for learning by doctors who want to apply or patients who want to know what's going on. So basically, we received the video, three videos with pathology and operative reports. This is what we create after we receive them. So the video is here. You can see you can watch the video, and basically, it's a surgery. It's an endometriosis surgery, and this video, specific video, is about 3 hours. I can fast forward it. But it's about 3 hours, 3 hours video. So the surgeon watches the video, maybe passes some static point. So basically watch the video, check the pathology report and operative report. I won't click on them because of the privacy. Then on the right side, you see this says video evaluation. So let me get back to, this video, if you remember, it was 32x3. That's how we identify the videos. So basically what we ask surgeons to do is to put their email, their name. This is reviewers, right? That's a video vetted surgeon who now reviews other surgeons for video vetting. So your email, your name, this is the reviewer. Reviewer doesn't know who this surgeon is because there's no identifier, and these pathology reports are also de-identified. Video ID now, we ask surgeons to rate the adequacy of exploration in different parts of the body, upper abdomen, for example, posterior cul-de-sac. They can say not applicable, up to excellent. So there are different explanations for that. I'll get into more details later. And comments, and so then here is how endometriosis was treated: fully excised, partially excised, ablated only, left untreated, or not applicable. Obviously not applicable means like there is no pelvic side wall lesion. So, but it's, I think, self-explanatory. They scroll down, they can add a comment. Then how the surgeon preserved normal tissues. So ovaries and fallopian tubes are the most important ones, so that's why we put them here. And how the surgeon implemented the techniques like tissue handling, dissection, bleeding, adhesion. And then at the end, so surgeon can give different comments. At the end, they rate the surgery. They give a number from 1 to 10 based on the quality of surgery in every area, like stage 1, 2, stage 3, 4, endometrioma, fertility, urinary tract, deep bowel, diaphragmatic, thoracic, cardiac, and then add a general comment. Then submit the video. So when they submit the video, they submit the review, we get the results. On the back end, let's look at one of the reviews that we got for this specific application, okay? So this is what we see on the back end. This is the email, then obviously you won't see it because we have identified the review results. Remember, this is a double-blind review. Reviewer doesn't know who the applicant is, and applicant won't know who the reviewer was. So it's a double-blind process. So video ID was of 32x3, but now exploration, okay? Upper abdomen. So this surgeon has done a great anterior posterior cul-de-sac. For any reason, this reviewer thought it's not necessary to do the others. Good exposition of the pelvis. I just go now in different regions, fully excised in most regions, ablated in bowel, obviously, and ovaries. So handling was excellent. And you go down like the techniques and good surgical procedure in general. So for step 1 and 2, this surgeon got 9, for 3, 4 got 7, fertility, urinary tract, deep bowel. So here is the thing. You remember in bowel it wasn't fully excised. This surgeon didn't give a score above 6. Remember, each surgeon needs to get 7 and higher to pass. So this surgeon, because for deep bowel they only ablated the lesion, they didn't get the full score. So based on this review they didn't pass, but you have to see other reviews as well. So then at the end, like good dissection, good handling, good excision. I think the bowel was undertreated, However, it depends on the clinical issues. Of course, sometimes it's a decision made by patient and doctor that, okay, don't excise my bowel. That's what it means. So this is a perfect example of that review. Now, you might say, okay, some people might say, so surgeon can send their best videos, and that might skew the results. And the response to that is, okay, if you're not even good enough at your best, you're not going to be good enough at your worst or at your average, right? Now let's look at one of the reviews that didn't get the best results, but this surgeon obviously improved so much after this review. But I thought maybe I should just show you one of the reviews that we got and the surgeon didn't pass. So let's read the comments. This case is this case of peritoneal endometriosis. Dissection doesn't follow any rules. You can go and read that. How would you improve this surgery? Adequate surgical techniques with the standardization, prevention, no bleeding, improve the surgical outcome. Now let's look at the reviews of this surgeon. The scores. So for pelvic endometriosis got 2. Remember, 7 to 10 is the only score that the surgeon can pass. 2, and fertility endometriosis 2. So this surgeon obviously didn't pass the vetting. So their best case was this, and they didn't even pass the vetting, right? All right, I wanted to show you how the vetting looks like from the back end. And the surgeons who apply, they get this score, they get these comments. Then they can go and improve and come back with more knowledge or more skills in a few months or years. But I hope it helps clarification and it helps with the transparency of the vetting system. Thank you for paying attention.